Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. In the video today, I would like to talk to you guys a little bit about oral pathology, specific to the teeth though. So how the teeth come in, how the teeth form, how the teeth develop, what happens if the teeth are sort of fused together, you know, things like that. And actually, I just want to make my screen a little bit smaller because I noticed here it is huge. I don't know how it looks for you guys, but it's huge for me, huge. And I want to share my screen as well. So I'm just kind of moving a screen over here because I do want to share that with you guys. So let me just share my screen. Okay, perfect. So can everybody see that? Okay. So I was talking to my students of the Dentalelle Board Exam Prep Academy and the Dentalelle student program, and they would all like to talk about oral pathology a little bit more. And as you all know, that's a huge unit. Like, it's huge. So it's probably going to take us at least a few sessions. But what I would like to do for them is have a full PowerPoint where I show the image first and then multiple choice questions, and then they have to pick from there what the image is. So it's going to be a very exciting session. So if you would like to be a part of that, let me know, because you know it will be very informative and you will learn a lot because as I said, oral pathology is huge. But that is something that you have to know for the board exam. If you're taking oral pathology in school now, it's very overwhelming. So I am happy to help if I can help. So, okay, so let's just talk a little bit about the pathology specific to the teeth at the moment, okay? So let's first talk about endodontia, and I did leave myself a few notes so I don't forget the specifics, because there's a lot of specifics that you guys do have to know. So does anybody remember what that means? So what is endodontia? That is when all of the teeth are absent. Is this common? Obviously not, okay? Because in fact, I've never seen it. I've never heard about it other than a textbook. But this is when all of the teeth are not there, okay? So absence of all primary and permanent. So they just don't have any teeth. Let's see, that's as specific as it gets. And you may be wondering, well, what happens then? If somebody doesn't have all of their teeth, how do you even go about that? So they would obviously need a full set of upper and lower dentures or implants, but that would be pretty intense if you think about it, having implants for every single tooth. Possibly a few implants on the maxillary, a few on the mandible, so that the dentures can attach properly. It's hard to say, but something would have to be done for sure, because imagine having to go through life and not having teeth. That would be nearly impossible. Okay, so the next one here, I'm just kind of moving up my thing so I can keep on track, is hypodontia. In fact, I will highlight the one that I'm talking about. So hypodontia, does anybody remember what that is? So this is a lack of one or more teeth. So it does have to be at least one, but it could be more. And this could happen to pretty much any tooth. So one or more teeth are not there. Let me see here. So the most common ones that I made a note of are your third molars, maxillary lateral incisors, mandibular second and mandibular second premolar. So not so much the premolars on the top, but mainly the mandibular premolars on the bottom. Okay, so does that make sense to everybody? So one or more teeth are not there. And the sun is starting to come out. That's nice. Yay. Okay, the next one, supernumerary. That's a hard one to say. Supernumerary. What is that one? That is when somebody has extra teeth, okay? Extra teeth. So it doesn't say if they have, you know, 5 extra, 4 extra, 2 extra, it doesn't matter. Supernumerary just simply means they have extra teeth, okay? So they could have one or they could have more. So extra teeth. Now, for some reason, a lot of students get confused with hypodontia and supernumerary. So super, think they have more teeth than they should. Hypo means they have less. So hypodontia, so they're the opposites. So hypodontia is lack of one or more teeth. Supernumerary is they have extra teeth. The common ones for extra teeth just seem to be either the wisdom teeth or the maxillary incisors. Those I've seen extra, not often, but it could happen. You might be thinking, is it the centrals or the laterals that are more common to be extra? It's usually the centrals. So for supernumerary teeth, the best answer is the central incisors tend to be more common, and the second best would be the wisdom teeth. So that could happen. Another thing that I wanted to point out, which I'm sorry, I forgot to add here, but there's different types of extra teeth. So you could have, a mesodens. Does anybody remember what that is? Or you could have a distomolar. So we did talk about this, but I didn't say the actual name yet. So does anybody remember what that is? So this one is located between the central incisors on the maxillary. And the distomolar, since we talked about the wisdom tooth, this is common. This is located distal to the wisdom tooth. So remember how I said the most common supernumerary tooth is in the middle of the central, near the central incisors, and then the second most common is distal to the wisdom tooth. So now everybody knows. Okay, perfect. Let me just unhighlight that so everybody knows what I'm talking about. What about microdontia? Does everybody know what that is? This should be an easy one. Like this you should know. Any ideas? Oh my God, guys, sorry. I was just choking on my own saliva. Sorry, guys. I was just so excited about microdontia. So this is when one or more teeth are smaller than normal. So some students think that microdontia means that only one tooth is smaller than normal, but it's one or more is smaller than normal. Let me see here. The most common would have to be the incisors, the lateral incisors, or it could be your third molar, so the wisdom teeth. Now, the opposite side of things, what do you guys think is macrodontia? So this is when teeth are larger than normal. And there actually isn't any that are more common. It just could happen to any of them. It's a rare occurrence, but it could happen. So for microdontia, the more common one is the lateral incisor, but for macrodontia, there's not a more common one, but it does mean that the teeth are larger than normal. This is a good one, okay? Next one here, gemination. Does anybody remember what that one is? So that is when it is an incomplete formation of two teeth. So two teeth have not formed properly. It's more common in primary teeth, and usually the crowns are a lot larger. And that's because two teeth are coming in, but they haven't formed properly. So it looks like, listen up, it looks like a single root with two crowns joined together. So this is something that they usually have on the board exam. So you do have to know the difference. So for a gemination, it's one root, but two crowns are fused together. So does that make sense? So make sure you know the difference between gemination and fusion, but I will talk about that. Did I forget to mention anything? No, I don't think so. So one root and two crowns are joined together. So the next one is, of course, fusion. So does anybody know what that one is? So this is not the same as gemination. So fusion is different. So this means, okay, so it is a union of two normally separated tooth germs, and it can be complete or it can be incomplete. So how this looks like is it's a large crown with separate fused roots. So there's two roots and one large crown. But in gemination, it was different. You had two crowns and one root. Okay, and for fusion, the primary teeth are more common. I made a note that it's more common with the anterior incisors, but that's about it. Okay, next one, concrescents. I hope I'm saying that right. Concrescents. Now this one, for some reason, I would always, we had this on our test a lot in school, and I remember it actually being on the board exam too, but I could never remember what this was. I don't know why. But this is when two teeth adjacent to each other are, I guess, fused together by their cementum only. So not the enamel, but only the cementum. So it's two teeth. Their cementum is kind of like this. So there's two roots, but they're fused together by the root, not the enamel, but by the roots. More common in the maxillary molars. And it could happen if the tooth erupted, if it's unerupted, or if it's partially impacted. So that's interesting. Let's see. So a good question is this something that you could see in the mouth? Think about that. Is this something that you could see in the mouth? No, it's not, unless you can see the roots in the mouth. And that's because this means that the roots are sort of fused together. So not the enamel. I know I've said this a lot, but I just want to make sure that everybody understands. So not the enamel, but the roots are fused together. Okay. Next one, dilaceration. This is when your root isn't straight like it should be, but it's curved. So either one root of the tooth is curved or more. It could be one, it could be both, it could be all, but to keep it simple, it means that the root or roots is curved. Let's see, what else did I make a note of? I just made a note that, think about it this way. If a patient needs a root canal, this would be a very tricky root canal to do because the root isn't sort of how it should be. It's curved. Not the whole thing. I wish I could show you an x-ray, but it's curved at the apices, if that makes sense. I'll be showing a lot of pictures and a lot of x-rays to my students. So if you do want to be a part of that, let me know. We're having our oral pathology unit with the mock exam questions and PowerPoints and images in about 2 weeks. So almost there. Okay, the Enamel Pearl. I actually have one of these. And every time I get my teeth cleaned, they think it's cementum. Or sorry, they think it's calculus. And I say, stop it. That is not calculus. That's an Enamel Pearl. You should be able to tell the difference. But anyways, a new student or a new hygienist, maybe not. But if you're trying to clean it and it's not coming off, and it's not becoming smoother, then you know it's an Enamel Pearl, likely. So what is it? So it's this little sort of pearl-like, I guess, piece of enamel that is located near the root surface. So it's near the enamel and near the root. It's usually found on maxillary molars, attached to the cementum near the root of a bifurcated tooth or a trifurcated tooth. So it's not common to have it on a one rooted tooth. But if there's 2 roots or 3, it's more common because it's usually in the middle or near the middle of that furcation area. I forget where mine is. I seem to think it's on the second premolar of quad 3, but I can't remember. But it's somewhere on the bottom. I know that. Okay, next one, the Talon cusp. I remember having this on my exam a long time ago. So do you guys remember what this is? So this is when the cusp is like, it has an extra cusp, if that makes sense. So it's a cusp that has an accessory cusp. So it could be the cingulum of the maxillary or mandibular permanent incisors. And they call it this because it's supposed to look like an eagle's talon. An eagle's talon, I don't know what that looks like, so I wouldn't know, but that's why they call it a talon cusp. So it's like an accessory cusp, if that makes sense. And people may ask, well, if there's like a cusp on top of a cusp, do you have to remove that? Only if it interferes with the patient's occlusion. I've never seen it actually interfere with the occlusion, only if they have to have a filling done in the opposing arch, then you may have to adjust that filling a little bit more, or you may have to go and look at the talon cusp a little bit more and make it, you know, smoother or rounder. But if it's not interfering with the occlusion, then you don't have to worry about it. I haven't seen it interfering usually, but it could happen. Okay, so the next one. I don't know how to pronounce this, so Tarodontism. Tarodontism. Sorry guys, I am so bad with pronunciation. Tarodontism, oh my gosh. I could never teach oral pathology. I tutor oral pathology, but I could never teach it because I would not be able to say anything. So this is when they have elongated large pulp chambers and short roots. So large pulp chambers and short roots. So try to picture that. It looks pretty interesting. And it's common in primary teeth, the molars, and in permanent dentition, it could happen anywhere. So that's interesting. So think about it this way. The roots are short, but the pulp is overly large. So short roots, large pulp. Last one, exciting, right, you guys? Exciting. So the last one, Stens Indent. Stens Indent. I think that's how you pronounce that one. So this is when there is a tooth inside a tooth. So it looks interesting on the x-ray. I've seen it actually a couple times. And when I pointed out to a patient, they're like, oh, what the heck is that? So it's a tooth within a tooth. It's usually a single tooth. Anterior incisors are the most common. And it's usually at the coronal third, if that makes sense. So the coronal third of the tooth, so in the middle of a single tooth. So it doesn't usually happen more than once in the mouth. It's one tooth, and it's a tooth within a tooth. What else did I say? It's of normal shape, but the crown could look a little bit off, but not always. So it's typically a normal shape, but it could be a weird shape, either too big or too small. Let's see. So yeah, and that's all I have for that one. Awesome. So does anybody have any questions so far? Let me know. If you would like to be a part of the oral pathology session, I'll write down my email for everybody. Feel free to send me an email, and then I will tell you how to sign up for it, because we will learn a ton of stuff. I'm pretty excited. I teach oral pathology to my students at least every 6 months or so, but it depends on how many new students I have, because the last oral pathology we focused on was pretty much looking at the macules and papules and like all of the things that happen on the face. But this time, it's inside the mouth looking at the teeth. So there's a lot to do with oral pathology. So if you need help, let me know, and I will see everybody soon. See you later.